The videos of Swot nurse notes serve as worded explanations and for demonstration purposes only. These notes are based on the owner of the channel's understanding. The channel's purpose is to assist with studying and to help with adapting to the UK clinical setting. These notes are short and simple for persons to better have a foundation knowledge to build on. This, however, does not serve as a specific guide to the NMC OSCE and CBT exams. Hey everyone, did you know? With diabetes there are many things that comes to mind. Two things that stands out are a metabolic disorder and high glucose levels. There are many diagnoses that are related to diabetes. These include gestational diabetes, type 1 diabetes, diabetes insipidus, neonatal diabetes, type 2 diabetes, diabetic ketoacidosis, etc. Pregnancy is a beautiful experience, mixed with pain of course. And there are medical conditions that can develop. Gestational diabetes is one of many. The hormones estrogen, cortisol and human placental lactogen blocks insulin, causing an increase in glucose levels within the blood. It usually begins 20 to 24 weeks in pregnancy. Common signs and symptoms include frequent urination and increased thirst. Good news is that it should go away after birth. Bad news is that it increases the risk of developing type 2 diabetes in the late future. Healthy lifestyle choices is therefore important to lower the risk. Babies are a bundle of joy. Oh, what smiles they bring. Neonatal diabetes, however, can dim the smiles on parents' face as they attend to the needs of this condition. Neonatal diabetes occurs in the first 6 months of life and is caused by a single gene mutation that affects the production of insulin. This leads to increased glucose levels in the blood. This is not the type of news you want to hear, a diagnosis of type 1 diabetes. It is otherwise called juvenile diabetes. With this medical condition, the body mistakenly attacks the beta cells of the pancreatic islets that secretes insulin. Due to now insufficient insulin hormone that allows cells to absorb glucose from the blood, this results to the spike of glucose within the bloodstream. The type that is common? Type 2. With type 2 diabetes, cells in the muscle, fat and the liver become resistant to insulin. As a result, not enough glucose is being absorbed from the bloodstream. In addition to this, a next cause is when the pancreas does not produce enough insulin to maintain healthy glucose levels. Poor lifestyle choices can increase the risk of developing type 2 diabetes as well as genetics. Oh, it's the diabetes insipidus? Just a quick revision. Do you remember the hormone called the antidiuretic hormone, ADH? It is also called arginine vasopressin, AVP. Well, this hormone regulates blood pressure, blood osmolality, and blood volume. And so when the level of water in the body decreases, the pituitary gland would releases this hormone to conserve water and stop the production of urine. Now let's get back to what is diabetes insipidus. With this condition, the hormone fails to properly regulate the body's level of water and therefore too much urine is being produced and passed from the body. Diabetic ketoacidosis? Body cells are unable to use glucose for energy as it should. As a result, the body thinks it's being starved and the breakdown of fat becomes the major source of energy. The breakdown of fat releases what is called ketones. High levels of ketones makes the blood and tissues too acidic and can cause complications or even death. Now here are examples of the signs and symptoms of diabetes. I think I left a few off the list. Do you remember what are some of the signs and symptoms? Please answer in the comment section below. A blood test? Yes, that's exactly what is required to confirm if a person has diabetes. It can also be used to monitor blood glucose levels. Here listed are some of the tests that are used. A 2-hour postprandial glucose test, an HbA1c test, fasting blood sugar test, glucose tolerance test, random blood sugar test. Did I leave any test off the list? Please comment below. We are now going to look on each of these tests individually. An HbA1c test. This is otherwise called glycated hemoglobin test. For this test, no fasting is required. It shows the average amount of sugar in the blood for the last 2 to 3 months. The higher the glucose level, the more hemoglobin is attached with glucose. After doing an HbA1c test, the results are as follows. An HbA1c level of 6.5% or higher tested on 2 separate occasions confirms a diagnosis of diabetes. An HbA1c level of 6.0% to 6.4% is an indication of pre-diabetes. And a HbA1c level of 6% or below would be considered normal. Random blood glucose test? Yeah, you heard right, random. The name speaks for itself. This is a casual blood glucose test where a sample of blood is taken at a random time despite when the last meal was eaten. It involves pricking a finger where a small drop of blood is placed on a test strip, after which a reading is given. Remember, a random glucose test is a casual test. This test may help a doctor establish if additional testing is needed to make a full diagnosis of diabetes. 200 mg per deciliter or 11.1 millimoles per liter indicates a diagnosis of diabetes. 141 to 199 mg per deciliter or 7.8 to 11.0 millimoles per liter indicates prediabetes. 80 to 140 mg per deciliter or 4.4 to 11.0 millimoles is considered normal. Fasting? Not the type of news you want to hear, ain't it? A fasting blood sugar test measures the level of glucose in the blood after an overnight fast. A finger will be either pricked or a needle is used to draw blood from a vein in the arm. Persons are expected to fast for 8 to 12 hours before the test. For this test, only water is permitted for drinking. Okay, now the fasting is over. The fasting blood glucose test results are as follows. If the results are 7.0 millimoles per liter or more or 126 mg per deciliter or more, this indicates a diagnosis of diabetes. The NICE guidelines regard a fasting plasma glucose result of 5.5 to 6.9 millimole per liter or 100 to 125 mg per deciliter as putting someone at higher risk of developing type 2 diabetes, particularly when accompanied by other risk factors for type 2 diabetes. Below 5.5 millimoles per liter or 100 mg per deciliter would be considered as normal. Now, for a 2-hour postprandial glucose test. This test requires consuming at least 75 grams of glucose orally. 2 hours post-consumption, blood will be drawn. Within 2 hours of eating, the blood glucose levels should return to normal. If the blood glucose levels remain high, this indicates a diagnosis of diabetes. Preprandial and postprandial means the same thing as before meal and after meal testing. The results for a 2-hour postprandial glucose test are as follows. A reading of 11.1 millimoles per liter or more or 200 mg per deciliter or more indicates a diagnosis of diabetes. 7.8 to 11.0 millimoles per liter or 140 to 199 mg per deciliter indicates a diagnosis of pre-diabetes. And below 7.8 millimoles per liter or 140 mg per deciliter is considered normal.